Hi, this is Dr. Smith and I am Jill Nesbitt, and today we're going to talk about some of the different philosophy behind the training manuals and some of the questions that I would think that dentists would ask us about how could we actually make this work in a practice of yours. So I'm going to ask a bunch of different questions. Dr. Smith and I are going to talk about it, and hopefully this is valuable learning as you're considering how this might work in your office.
What I base my whole practice on is just helping other people. That sounds simplistic and it sounds a lot of things, but I have to tell you what it comes down to is that you only have two choices. You do what's best for yourself, or you do what's best for someone else. Now, a lot of times it's sort of the same thing, but nevertheless, even though I may give up some profit by doing what the other person needs in spite of that, what I found is the more that I focus on other people, the more I try and help them, the more successful I've been.
Well, and I know, especially as I've taken over some of the responsibility of sitting through and running level meetings for general level and the secretary level, and you have maintained for years and years the assistant level and hygiene level, I know how much time you and I both put into staff training. And what's your thoughts on dentists who might say, well, I can't make that time? You know, I think that's another philosophy piece that I've observed, simply because when I'm expected to take part in it, I realize how much time it actually takes. What's your thought on staff training and the time it takes?
I never look at them as groups. I always look at them as people. And so if I'm writing something for an assistant, it's for whoever it's for Karen, it's for Cassidy, it's for that person. I think, well, here's something that if they learn that and they develop that piece of their career, then I can pay them more. They're more value to the practice. If they're more value to the practice, then our patients can make more use of them. We provide better care. So, well, in fact, one of the things I like to tell every new staff member is that my job is to pay them as much as I possibly can, and their job's to earn it. It just makes life so much easier. And then when you give that same amount of care back to them, it just makes your life better.
So thinking about staff and the long-term relationships with staff, because the other piece that I've seen us implement, you have a timeline for the staff person that they need to finish. You need to finish this level or they're not going to be working here. How do you kind of justify the piece, long-term relationships, but then also timelines for staff? If they don't finish, they are now unemployed.
And that's brutal. And on the other hand, and I'll be at a dental meeting and a dentist says, yes, Dorothy has been working with me right across the chair from me for 20 years, and I'm really proud of that. And on the back of my mind, I'm thinking, you know, that's a shame, because I would have fired Dorothy at 5 months, because she's not growing. You've watched another human being just sit and vegetate all those years. You never knew what potential she had. She never got past the point of just doing what she was told. And when I'm working with anyone in the office, part of my job is to make sure that they develop themselves as a person so that they can be of more value to not only to themselves, but also to all the patients and those people around them. And that level of confidence builds back into their family and their relationships. And also I can pay them more, so the thing that happens, the husband that can't work or he loses work, now she's in a position where she has to build a nice income for herself, and so she can help the family get through a bad period. Whereas if she's just sitting across the chair sucking spit, she's lost. She's just lost.
Well, I think that's definitely a challenging piece for doctors. I mean, I think that is a revolutionary way to look at staff training, because I know it's so much easier if you'll just stay there. I don't have to train anyone else to do what you do. But like you said, I've watched just the amazing opportunities in career development in our staff I mean, I'm thinking right now of Cassidy, who just got into level 7, our first assistant, who made all the way through level 7 in general assistant, as well as getting her FDA degree a year and change ago. And what an incredible difference in her life that has made, when it would have been really easy just to keep her because we already had an FDA in the practice.
Another piece that you have to be ready for is that when you become a change agent for another person, when you help that person grow, you can't tell where that growth is going to occur. And I've helped some people grow past their career with us at HealthPark and develop another career in some other field, and I'll help them with that for the same reason.
How should a dentist conduct a level meeting with a staff person? When do you have the meeting? What should you even talk about? How often do you meet with the same employee?
What I like to do, first of all, I limit the meeting to a half hour. If you have an open-ended meeting, they just go on and on and on. Also, I like the staff person to tell me when they are ready for a meeting. Now, I'm giving them a broad interval. It can be 3 months for a beginner, it might be 6 months for somebody that's in a higher level, that they're going to have, from the point they start, that's when it has to be finished. Now, then they're going to have their half hours. Now that's tough in your schedule because that's could be very much productive time for you. Then you have to decide if you have a staff person that is learning, developing, moving ahead, that you're going to be able to pass along and delegate more tasks to, how much is your time being leveraged by developing the skills of those other people? What I found is that I win by doing that. Now, I'm not going to show the staff person how to run the sterilizer. I've got people that can do that. What I will do, I'll have all the instructions in the training manual in how to run the sterilizer. Then someone on staff that knows that will teach that person and make sure that they can do it correctly. And then when they can do that, that task is marked down. So when I'm seeing them, I'm not teaching all those procedures, but I am going to review and say, okay, then you have here that you've learned how to run the sterilizer, and on most tasks there's a line that for the person who has done the teaching to write down there, I taught this person and they can do it well and the date that they did that. Because I want to put responsibility to that. I don't want them just coming back and saying, yeah, I've got all this whole level's done, this was easy. They've got to show me that they've got those tasks learned and learned well.
So how do you, when there's a new staff person, how do they know when it's time to schedule a level meeting with you?
Usually an office manager, or me if it's a smaller office earlier on, I would say, okay, by the end of the second or third week, I would like to have a first meeting with you. Get your feet on the ground, learn the names of the people and where the bathrooms are, and then we'll get started. So the first half hour is an initial feedback from me. One of the things that I really would like to stress is that you've only got two choices. You're going to have meetings with your staff. Now the question is, are you going to have meetings where that person comes in and you get to praise them for what they've accomplished and recognize their efforts that they're putting in and how valuable they are to the group and how much the group likes them? Or are you going to wait until they screw up? And then you're going to call them in, you're going to shut the door, you're going to have a box of Kleenex there, and you're going to tell them how inadequate they are and that they've got to shape up or ship out. What I've found is that I get so much further when I'm in the positive side working with my staff than when I'm on the negative side. Even when someone is failing, the worst thing isn't that someone's failing. In fact, you've got to be careful because I really don't, if you really care about the people that are on your staff, then their self-esteem becomes really valuable to you. So if someone is failing, what you want to do is just emphasize to them, you know, I'm not sure that this is really a career that uses your talents as well as they could be used. Let's try. I know you're giving it a good effort, but it doesn't look like, at least to this point, that you're going to be able to finish on time. And if you can't finish this level on time, then what that's telling us is it's not that you're not smart, it's not that you don't care, it's simply that your interests are in a different direction. So let's see what we can do, and I want to do everything that I can to help you. And the dark side to that is, though, we will recognize, you and I together, when you're not going to have a career here. But when you finish, and you know it's not going to be at HealthPark, you also know that everybody tried as hard as they could to help you stay here because they like you as a person. It's just that your skill set doesn't allow you to remain here as an employee, except at the very lowest levels, and you have more skills than to be a low-level gopher for the rest of your life here at HealthPark.
I've had some of those conversations with staff as well, and it really makes it a lot easier when things aren't going well, because as you well know, sometimes you get lucky and you hire a great person, and other times it's just not a fit. And that's such a nicer way to emphasize, it's not you, it's not us, we're just not the right fit. And they can actually, in a level meeting, give you their opinion. You know, I'm not able to make the time to study at home, you know, this just isn't working out for me. We can almost co-discover that. They maintain as much of their self-esteem as possible. I don't feel as uncomfortable or difficult having those conversations, which are necessary. And I know most offices, most dentists, nobody wants to have the conversation, you're failing and now you're fired. It's a much kinder way, actually, when it works, obviously, because now we're moving you forward. And when it doesn't, you know, we can also say we have a structure to help you advance, and that will give you not just career opportunity, but also more income. I would hate for you not to have that opportunity maybe you could find elsewhere. So I like, that makes my job a lot easier, the way that's been set up through the level system.
So it takes a level of stress out of the meetings. It takes a huge stress off me as the owner, because as long as I'm just assuming that what you tell me is the truth, and then all those under the surface kinds of thoughts and behaviors, they always come across in your body language and whatever you're doing. So as long as you just care about that person and you try your hardest to help them, but you've got your deadlines, and you also have the training manuals that says this is what you've got to know, and you have to be able to apply that on a regular basis. And the job, if they can't, well then they're done. But you can do that in a kind way.
It is. It's such a more straightforward way to measure performance. You don't have to just trust, well, I'm really working hard, or I think I'm doing well, or what other people say. You have a measured criteria, so you know exactly. Do you know how to run the sterilizer? Are things clean? You can ask a couple questions, knowing how the sterilizer runs and how much time it takes and that kind of procedure. And then you have the confidence that they know what they're doing on the specific criteria. I think it makes sense.